I've never like been in this much like continuous pain like daily.
Yeah.
Now, like that's why I had me a little worried.
A little bit more. Oh, there you go.
Ooh.
There it is. Hey yo. All right, man. So let's do some investigating real quick. So where exactly are you feeling that back pain? Show me where you feel it at.
Right here.
So right on that left side. Okay. How long ago did this start?
When I was 18.
18. Okay. And that was from?
I think from lifting weights and my knee giving out, and when I had the weight like the squatting.
Squats,
Yeah, it kinked on me, and
then that's where you felt that.
Yeah.
Oh, okay, gotcha. Okay, and so that makes sense why, you know, like we talked about with your lower back, how it's stressed, and you can tell it's been there for a long time.
Yeah.
And so 18 years old to today, yeah, we're gonna see that kind of pressure. Now the lower back, that's your biggest issue. You did mention you also get some leg pain, correct?
Yeah.
Where do you feel it at in the leg? You said it's in the back of the leg.
Yeah, it shoots down my leg.
Okay, and it goes down into the feet or just to the ankle?
Yeah, probably the ankle, not the foot.
Okay, so you don't really feel it into the feet, but just down up into the ankle.
Yeah, it's just a sharp, like, when it happens, that's where I gotta kind of like stretch it out too.
Now, when it happens, is it like a quick jolt, or do you feel like it's kind of like a dull agony?
Oh yeah, it's a dull agony.
Okay, so it's a nagging kind of pain here.
Yeah.
Okay, so it's a pretty consistent one. That's where you feel like you have to like stretch it out.
Yeah.
Okay, gotcha. All right, any neck issues?
Nah, they had asked me that, but you know, I'm constantly popping my neck all day.
Okay.
So I don't know what issue is and what's not issue
okay.
anymore.
All right, so you feel like you have to keep popping what's going on up here.
Yeah.
So do you feel like it's kind of like more like a stiffness or something like that? Or
yeah.
Okay. And so 18 years old, you did some weightlifting. When did you start construction?
Around that time, but I mean, I started like sweeping and doing all when I was 11 years old.
Oh, really?
Yeah.
So you've been working since you were pretty young then, huh?
Yeah, that's when I was really the gopher.
Yeah. Do you have family that's in construction?
Nah.
No. So how did you fall into construction?
My neighbor owned a construction company.
Ah.
To Rosemead, and I started working with them, and then I did a few other jobs, I guess, and like grocery.
Right.
Then I owned my own car shop at not car shop, like a mechanic shop in Upland.
Right.
I worked for a insurance company called Legacy.
Yeah.
It was like a health insurance for the elderly.
Uh-huh.
And then after a year, they started me at $25 and they kept me there, and I was like, nah, I'm out, dude. I can't. I'm like a bird in a cage here.
I can't survive on this.
I was in a cubicle, dude. Oh. 6'5". You know what I mean? A cubicle, 5x5 cubicle. And then when I would talk to like the people, like, hey, quiet, shh. Oh. And the guy next to me would be like, hey, you need to slow down with your work. You're going too fast. And I'm like, what the hell?
Really?
Yeah, I just couldn't do that no more. That office thing wasn't for me.
Yeah. Yeah, we got a lot of pressure right in here. Yeah.
I've never like been in this much like continuous pain like daily. Like
really?
not this long.
Yeah. Well, you know, and I'm glad that you let me take a look at you. I mean, this is why the analysis portion is so important to us, because we need to figure out what's going on, and we also need to know, like I talked about, like what's fixable, what's not. But the biggest thing is, what do I need to do to get that relief that we're looking for? So we're going to be doing some investigating here. So here is the left joint right here. This is your SI joint. So I'm going to go on the upper joint right here. We have the middle joint, and then we have the lower joint. Upper, middle, and then we got the lower. Any pain on those?
I would say that bottom one.
That bottom one down here? Okay. I'm going to go right into the lower part here. This is going to be your L5.
That one right there.
That's where you feel a lot of that. And we have 4. Not too bad. We have 5.
Yeah, that one I feel.
And we're going to go a little bit lower here. This is your sacrum. This is S1, S2, S1.
That one's just pressure, I think.
Okay, but the sensitivity is at L5.
Yeah. See, when I get up, I can't just, it's like I have to like use my left hand supporter and then kind of straighten myself up.
Okay. All right.
And when I sit down, I know I gotta put muscle on my left leg to know that I gotta go. Cause even right now doing this hurts right here. Not excruciating, but it's like, since I'm so used to it already, kind of like a normal phase for me now. It's kind of like, all right, I know what to expect.
Yeah, you're gonna bring your knees out and then in. So basically, you're gonna go like butterfly wings.
Oh, okay.
Yeah, there you go. Good. So I'm just looking for the motion and the movement of that pelvis to see what's moving, what's not, and if they're both moving, that's a good thing. Just the right side for me. There you go. Yeah, that right side's doing really good.
Yeah, see, I don't feel anything on that one, but even doing the butterflies, I feel the pain on the left side.
Yeah, let's do just the left side. You feel pain on that one?
Not by itself.
Also, when you do both.
Yeah, just when I do both.
So here's what I'm actually going to do. I want to start with the foundation, which is going to be your pelvis. Your L5 is definitely something that's sensitive, and it is a problem. So this SI joint, when I have you do the little butterfly wing,
yeah,
it moves, and then it dips even further. This left side, when it moves, but then it gets stuck. So this one, it actually goes here and then out, and this one, it goes here and then gets stuck. Gotcha. So we're going to start with this to get some movement in here. Here is T9, 10, 9.
Yeah, that one.
9, okay. Gotcha. All right, so here's 6, 7, 1. I'm on 7?
Yeah.
All right. All right, man, you ready to get to work?
Yep.
All right, the moment you've been waiting for. Let's get this guy going here, relaxing right here. Right on over here. So the way this is going to work, I'm going to get a little bit of push right here. I'm trying to push that spine forward. I just need you to relax your feet for me. There you go. Good job. Bring this arm down just a little. There you are, just like that. It's already moving here, so a little bit more. There you go. Ooh, a little piece. We got a little piece on that. We got a little more. No, that's it. Coming up. All right, do me a favor. Let's get you walking on that thing. Let's get you over to that door. And walking back over to this table. And then you walk back to the door again and come back to the table, okay? Right this way, come on over. Alright, man. Alright, so again, this is the one that kind of shifts going this way. And then it comes out to that left and then comes back over here. So we're going to see if I can get that to move back down here, okay? Relax on the shoulders. Nice and easy on that. Good. How you doing, man?
Good.
You doing alright?
Yeah.
Alright, let's get you walking again.
That's good right there.
How did it feel when you came back down? Any difference on that lower back yet?
Yeah, a little less pressure.
Okay, let's have you stand for me. Okay, did it grab on that left side?
Not really.
Okay, come back down. Good. Bring those feet together again. And scoot forward just a little bit. Give yourself some room. And then feet together, and you'll bring those knees out. Okay, any difference that you feel in that?
I mean, I feel the left leg a little looser.
Okay, good. And let's just do the left side. Good. Let's do the right side. Good. Good, man. So things are starting to move a lot better on this thing here, okay? Essentially what happens is when you damage a joint, you damage the tissues and the ligaments. When that happens, the tissues, they become like the scar tissue develops, and scar tissue is almost like glue. When that happens, the joints of the scar tissue get stuck. The scar tissue acts like glue. It's not going to allow it to move the way it's supposed to. When you go outside the office, there's a couple things I want you to remember. Is one, you can feel some soreness with the adjustments. If it's been this way for such a long time, when we go and start moving some things, your body's like, oh, this is different. Yeah. When that happens, you're like, oh, it's kind of sore, you know?
Okay, I feel that right here.
Uh-huh. On that lower part?
Yeah.
Okay. So it's going to start changing. The pain will start to change. With sciatica, what's very common is a lot of times people will still feel the pain. Sciatica can take some time, but what will happen is people will start to feel the pain goes from here, it'll move to here, it'll move to here, it'll move to here, and then it goes away. That's what we want to start seeing, is that slow progression of that pain starting to diminish, okay? So ice is your best friend. So 15, 20 minutes, get an ice pack, put a paper towel around that area to help with the inflammation, to reduce some of that. That's going to help to ease up some of the pain and get you a little more relief, okay? Ice is first thing. The second thing is, I'm not too worried about it because you're probably moving a lot at your job, but walking is the best form of exercise, getting some movement in the body. The work started today in the office, the work continues outside the office. So when you're moving and stuff like that, your body is undoing the years and years and years of stress that you've developed, okay? So that's going to be the second thing. The other thing is, how's your water intake?
I drink water all day.
Do you? Okay, good. Water is important, man. You need to really get those joints.
Out and all that.
Did you?
Yeah, maybe a few months back.
Okay, okay. Well, keep doing that.
Yeah.
Water's good. We want to make sure we lubricate those joints, okay?
Yeah.
So that's going to be it for today. When you come back in next time, I'm going to reassess how you're doing, but I'm expecting to see some great results with you, man. I really do think that hip is going to be the one that's going to open up that pressure.
Sounds
okay?
good.
I'm glad you're here, man.
Appreciate it. Thanks,
yeah.
Al.